We know understanding Medicare can feel overwhelming, so we're here to help answer the most common questions, starting with the basics, such as what is Medicare? What are your options? And when and how can you decide on the Medicare plan that's right for you? First, a bit of background. Medicare is government-sponsored health insurance for people 65 and older. It's also for those under age 65 who have a qualifying disability. Medicare is funded through your federal taxes. Once you're eligible to receive Medicare, the federal government deducts money from your monthly Social Security benefit. This, plus what you pay while you're working, funds your Medicare coverage. Understanding the different parts of Medicare will help you determine your options and what's right for you. Original Medicare has two parts. Part A covers expenses for hospital visits, hospice care, and some home health care. And once you turn 65, you'll likely be automatically enrolled. Part B covers 80% of most medically necessary doctor services, outpatient treatments, certain medications, medical supplies, and durable medical equipment after your annual Part B deductible is met. If you enroll in Part B, you'll pay a monthly premium based on your income. You can apply by contacting your local Social Security office. Once you enroll in Original Medicare, you can add Medicare Supplement insurance. It's an optional policy offered by private insurers that helps pay for what Original Medicare doesn't cover. This includes out-of-pocket costs such as certain co-pays, co-insurance, and deductibles. You can also add prescription drug coverage, or Part D. This helps cover the cost of certain prescriptions, so it's important to know if any medications you're taking are covered. This plan is optional and offered by private insurance companies. If you choose a prescription drug plan, you'll want to enroll as soon as you're eligible because late penalties can be pricey. You also have another choice, a Medicare Advantage plan, also known as Part C. This is an all-in-one plan that offers the same coverage as Original Medicare, plus added benefits that may include prescription drug, dental, and vision coverage, as well as hearing services and fitness programs. When it comes to enrolling in Medicare, your first opportunity begins 3 months before your 65th birthday and continues for 3 months after your birthday month. This is called the initial enrollment period. Each year, the annual enrollment period begins October 15th and ends December 7th. This is your chance to enroll in, switch to, or drop a Medicare Advantage plan. Immediately after, on December 8th, the lock-in period begins and runs through October 14th. During this time, you may return to Original Medicare, but cannot switch to Medicare Advantage unless open enrollment has begun. The open enrollment period starts January 1st and ends on March 31st. During this time, you can make a one-time switch to disenroll from your Medicare Advantage plan, switch to another plan, or return to Original Medicare. There is also a Medicare Supplement open enrollment period. This lasts for 6 months and begins on the first day of the month you turn 65 or older. You must also be enrolled in Medicare Part B. During this time, insurance companies cannot refuse you a plan or charge you more based on your health. You may also qualify for special enrollment periods throughout the year for certain qualifying events such as moving, losing employer coverage, receiving Medicaid benefits, or other reasons. All Medicare recipients have certain rights, so if you have questions, contact the Centers for Medicare and Medicaid Services or your state Department of Insurance. You can also reach out directly to your insurance provider. There is a lot of information out there to help you decide on the best Medicare plan for you. Medicare.gov is a great place to start. You can also call 1-800-MEDICARE 24 hours a day, 7 days a week.
Ready to speak to a licensed insurance agent? We're here to help you feel empowered, informed, and confident. Call 833-265-9655. Thank you for your time. We hope this presentation helped answer your questions about Medicare.